Hi, John.
Hi, Alex.
Hi, are you all right?
I'm all right. You all right?
Yes, I was just enjoying that music, to be honest. I was getting quite chill. I don't know if you're happy to give an update at the moment, John.
I am. So the most important update, afternoon everybody, is that I've been accused this morning of wearing a cardigan, and I'd just like to assure all the people listening and watching to this, it's a sweatshirt. It's not a cardigan. My executive team have been very cruel and teased me mercilessly that I'm old. Welcome to Anne-Maria, Director of Nursing Quality, and Julie Attfield, Exec Director of Mental Health, Learning Disability and Specialist Services. So yeah, brief update from me. Again, I hope it won't sound too much like Groundhog Day, but to start with, a big thank you to everybody again for everything they're doing. We do appreciate it. It's really tough, and the numbers in the NOTS system across the county and indeed in the East Midlands are still not moving down as quickly as we'd like in terms of case rates, particularly in the more elderly age groups. The numbers of admissions to hospitals continue to increase, although at a slower rate of increase. I suppose more positively, people have seen on the news that overall across the country, the case rates are starting to come down, and the infamous R value on average is now at 1 or less, although it's still slightly over 1 in the East Midlands. But at last, things are going in a better direction. I appreciate across the whole of the organisation, people working really hard, continuing to work in really challenging circumstances, having to manage social distancing and PPE, and appreciate the work that everybody's putting in and keeping our services going. And as previously, the trust remains in a relatively strong position. So from that perspective, we're okay. There is light at the end of the tunnel. I apologise, that's a bit of a cliche. I'll talk a little bit about the vaccination programme in a minute. The number of outbreaks is remaining steady. I'm not sure, Anne-Marie, I think the last count it was 15 or thereabouts. And we continue to remind people to stick with social distancing, stick with PPE, and particularly as you come out of the sort of clinical areas, to not drop your guard. You know, it is a bit of a fag, but we just got to keep on trucking in that direction. We'll get there. Good news on the flu vaccination rate, so 79%. We will get to 80. There are still some opportunities to get your vaccination for your flu. So look out for that if you or you know people that haven't had one yet, to avail yourself of it. And then on the vaccination front, overall, you'll see the figures on the news and in the media, well over 6 million, and the rollout is strong. The 4 priority groups, we've met the first target as a county last weekend, so that was care home residents and care home staff. Got to 95%, which was a phenomenal achievement. The other cohorts, which include health and social care staff, we're on track to hit the target by the middle of February. There's a bit of this come up in the questions that we'll come on to more specifically when we get to those, around the challenges around vaccine supply, the difficulties in making sure the second dose is compliant with the changes to the policy. But I suppose a couple of headline pieces for people is that, like I say, we are on track. We are identifying those of our staff who are clinically vulnerable, shielding to and try and enable them to get access to a vaccine more speedily. But I can't overemphasize how much command, control and scrutiny is on this. We would like to have a bit more autonomy to move the vaccine to particular places, to start doing our inpatients, to focus on particular staff groups, to perhaps do second doses earlier, but there is no leeway whatsoever, and we're scrutinised to within an inch of our lives to make sure that we're abiding by the rules, and to say that, you know, we have had conversations in the other direction, say, well, we think this is probably a better way of doing it, but it's been really clear. Sentences have started with, let us be crystal clear about this, and for avoidance of doubt. So that they're the sort of scenarios that we're working in on that. We're hoping that the vaccine supply will remain steady and continue to improve. This week particularly is a bit lumpy, and we're still working on you get what you receive rather than an ability to order in what we do need. All the sites are now up and running, and we should see access continue to improve. And there's an awful lot of other stuff going on, but probably because I know there's quite a few questions, Alex, I'll leave it at that in terms of from an introduction from me. Thanks.
Excellent, thank you so much, John. I know we had a question last week just raised from a bank worker at Rampton, and it was just whether that you've got an update on that, please, if there's following the discussions about the compensation for shifts they've worked.
Oh, you've thrown me now, because I've got to go to another.
Don't worry, John. Don't worry, John.
I have somewhere, haven't I? I know I have.
Don't worry, I'll come to that later on. No, that's fine.
It's there, isn't it? So at the end of those two, the first piece on the update,
just at the very beginning.
To specific bank workers, we can do a look back on shifts they've worked in the preceding weeks before they had to self-isolate, and calculate an average in order to provide payment for shifts lost. And we're pleased we've been able to find a pragmatic solution, so that staff haven't been disadvantaged by having to self-isolate.
Absolutely, thank you ever so much, because it was just an update from the question that was asked last week. So yeah, that's great. And linked to the vaccine and what you've said already, John, just thinking about, there's a question, and it was on Facebook, and it was asked, can I ask, will we be contacted to go in early for our second coronavirus vaccine if they decide that 12 weeks in between is too long to be effective? World Health Organization said it should be 6 weeks. I only ask as I'm vulnerable and, like others, want to be best protection from this vaccine. But if the effectiveness is reduced because of the long gap in between, this is again a worrying time. Thought having this jab was a step in the right direction, but not too sure now if it's going to work.
Yeah, it's a great question, and it is a worrying issue for everybody, isn't it? And the vaccine manufacturers and companies that have run the trials will only be able to comment on the data they've got from the trials. So they can, at the moment, only comment on the efficacy at using 3 and 4 week second doses, and therefore, understandably, wouldn't comment or wouldn't be able to comment on the efficacy at 12 week. But again, we have been instructed that it will be 12 weeks. Given the efficacy data. In an ideal world, 3-4 weeks would be what we'd like to do, but at the moment there isn't any room to negotiate that. So again, we're instructed. We've pushed back hard, as have other, not just trusts, but for example, the BMA and other groups have been lobbying. But the 4 national medical directors of the UK are currently at one with this. The situation may change, but at the moment it's 12. And at one point we did a sort of halfway house and moved some doses back to 10 weeks, second doses back to 10 weeks. But they've got access to our data, and they've compelled us to move them back to 12. So some people have had, quite a lot of people have had changes to their second dose appointment. So it's been a really tricky conversation to navigate, and we'll keep people updated as if there is any change. But at the moment it's week 12.
That's great, thanks, John. Just to highlight as well that in the chat, Anne Maria has said that we've done approximately 4,300 staff have had their COVID vaccination at the moment, which is absolutely fantastic, and that the flu vaccination programme is at 79%, which again is amazing. So thank you ever so much for that. There's a couple of further questions just linked to the vaccination, and a colleague has sent in a question which I won't read out in full because there's a lot of data included within it. But the questions are related to the testing regime and new emerging information and analysis from experts. And the first question related to that is, what is the cycle rate that our PCR tests are being run at?
Right. So this is a controversial area, and without getting into too much technical detail for today, I'd sort of prefix my answers to a couple of comments. So it's a controversial area because there is quite a strong commentary on what's called cycle threshold, or CTs, for the PCR COVID tests. And it's controversial because there is a view that the number of thresholds can be altered to influence the number of positive tests. So my first point will be I think it's important that people avail themselves of the information, go to fact checkers and have a look on trusted websites to form a view. And the reason I know a bit about this is there's a chap in the village who's completely addicted to CT, cycle thresholds for PCR tests, and is of the view that it's all a huge conspiracy. And the narrative goes something like that you can set the number of cycles on your test machine to higher or lower, and the higher number of cycles do, more. Have you got I think she's scared. Sorry, someone's got their mic on? Could they switch it off? That's better, thanks. So you can fix the number of thresholds, cycles to higher or lower, and the higher you go, the more cycles you do on your PCR test, the more chance there is of getting a positive test. And the conspiracy theorists go that they're all turned up to a high number, therefore there's lots of false positives, and once the vaccine is distributed, the cycle numbers will be reduced and the positive test scores will go down, and everybody will be happy. I don't know specifically if the ones, because we don't use these tests ourselves. They're done in the acute trust labs at NUH and Sherwood Forest, and there are lots of different types. The majority are sort of sealed black boxes where you can't set your cycle thresholds. They're automated, and again, without getting into too much detail, the cycles essentially relate to the number of times the solution is heated and cooled to double the number of any potential DNA strands of the virus that might be present in the sample. And of course, the astute among you will know that the virus is an RNA virus, and there's another part to that, the methodology that converts the viral RNA to DNA, and then grows it. And as it grows, if it's there, it reaches a point where it fluoresces, and that gives you a positive test. And I'm sorry if I'm boring people. It's quite interesting, but that there is a fail-safe that, and many of the approved machines have a fixed number of cycles above which you automatically record a negative response. So there is a fail-safe mechanism in it. I know there's you can look and find controversy and concern as to whether we should be so reliant on PCRs, but they're at the moment they're regarded as the gold standard for detecting viruses, and that's what we're using. Sorry, Alex, that was a bit of a long-winded answer, but I hope that's helpful.
Yeah, definitely. Thank you. Linked to that as well, the same question. Catherine Pope said you should have been a science teacher. I agree. So, and Jen Gwivers said, thank you for the clear explanation. And Anne-Maria has said that's why the CEO knows his stuff. So that's why, absolutely. Another question was linked to that was, has the Trust seen the Corman-Drosten review?
Well, the only reason I know about that because I saw it in the Q&A and looked it up, and that relates to what some of what I've just been saying. So I think there's an emergent concern around some of the methodology behind how the PCR testing apparatus has been set up, and the WHO are looking at it. Currently, I'm assured that what we're using is robust and reliable and valid, and if there are updates or changes, we'll obviously let people know.
That's great, thank you so much. Linked to, I think you've probably already covered this, but just so that all questions that are sent in are asked. Has the Trust done anything to challenge the current government advice to space out the COVID-19 vaccination second dose by 12 weeks?
Oh yes. So and that started before Christmas. My initial response was that I didn't think it would be that controversial to stick with the 3 or 4 weeks, despite what some of the regulators were starting to say. But I personally got some very short shrift from them. Again, that's the sentence started with, "Let me explain this clearly." And we've continued to or initially we continued to lobby an argument for sticking to what was in the original license, but it soon became clear that that wasn't going to change anybody's mind. And I think from a pragmatic position, that goes something like, you can get a significant amount of immunity with one dose. At the mortality rate that we've currently got, let's try and get as many first doses into the most vulnerable people in our population as soon as possible. I think is a reasonable position. I completely accept that it goes against what was in the trial data, and that there are strong arguments for having the second dose as previously described. But personally, I think that the position that we've reached at the moment is a reasonable one to take. We're not in an ideal world, and there are some very difficult decisions that have had to be taken. So yes, we have pushed back, but there are other more pressing challenges now that we're having to face with what's still a relatively limited supply.
That's great. Thank you ever so much, John. I think it just shows the difficult position that everybody's in at the moment. So thank you. Linked again to the vaccine, there's a question that's been asked. What is the Trust doing to assist those staff members who work in bases not in Nottinghamshire to get the COVID vaccine? Not everyone has access to a car, and we have been told that public transport is best avoided, and indeed Kingsmill Hospital is not particularly easily or cheaply accessible for those outside Nottinghamshire. Does the Trust not feel that this should be rectified as a matter of urgency, as it especially leaves less financially well-off members of staff disadvantaged and at risk? If nothing can be done, then at least a little sensitivity might be in order, as talking about second vaccinations without at least acknowledging the difficulties certain frontline staff may have in accessing even the first vaccination is more than a little irksome. It seems that we are often the forgotten and Cinderella services of the Trust, but a duty of care surely applies for all staff.
Yeah, thanks, Alex. I don't know if Sarah has appeared on my screen, whether she might be able to answer that in a bit more detail in terms of site access for our staff.
Thanks, John. Hi, everybody. I'm Sarah Furley. I'm the Director of Partnerships for the Trust, but also leading across the system. And I understand that question and how we make it easy for our staff outside of Nottinghamshire to access vaccination centres. So we are liaising with all of the systems on our borders, and we have agreed ways for Rotherham, Bassetlaw, Leicestershire and Lincolnshire about how our staff access those systems vaccination centres. Depending on whether you're a resident or depending on whether you're an NHS employer, actually changes the way you access those different local services. So what we're doing is we're making it absolutely explicit, and we'll publish that in the next 48 hours through either John's daily message, first of all, and then on Connect, so that if you're a member of staff working outside of Nottinghamshire, it'll make it really clear how you do it. So watch this space, we're on it, and a lot of our staff have already been vaccinated outside of this county. So we know how important it is, and as I say, we'll come back to you. So John, that was all I was going to say, so I'll hand back to you.
Thank you, Sarah. That's great. I've got a was there anything else you wanted to say on that, John?
I don't know. I'm not sure. Has that answered the question?
I think so.
Yeah. No, nothing else from me. Thank you.
Okay, thank you. There's a question which I'll send to Julie Attfield, if that's okay, which is that and there's quite a few conversations happening about this as well. I've not received my voucher that I was sent before Christmas. Is there a reason? Thank you.
Thanks, Alex. We're going from all that science to something that we thought would be simple and straightforward. So I'll start with an apology. We felt it was a really positive thing to do before Christmas to thank staff by sending those shopping or access to those shopping vouchers. And thank you for all the positive comments that we've received about that. We know it hasn't been as straightforward as we'd hoped, and that people have struggled to get some of the vouchers. I think that's been in part due to some of the retailers themselves, but we've actually found that one of the reasons is our internal email filter has been working very well, but in fact that has blocked a lot of people's vouchers. So we found that out yesterday, and that was particularly in relation to Sainsbury's, Morrison's and some of the others. So I'm sorry if you've been waiting for some of those specific vouchers. We hope that that's been rectified, and in fact over 3,000 emails were released yesterday. So apologies for all this, and we hope that's helped to resolve some of the issues. If you've still got problems, please do contact Voucher Line directly or email our HR voucher codes email address. So we will put those details in the chat. So we're really sorry that that's not been as straightforward as we wanted, but we hope that you do get receipt of those very soon.
Thank you ever so much, Julie, and I'll make sure more information goes online. Thank you. And there's been a question in the chat that Anne-Maria has said that she will answer. Is there any information or updates that can be given to community teams regarding patients and staff infection rates, so staff are aware of infections and risks in their workplace?
Hello everybody, my name's Anne-Maria Newham. I'm the Executive Director of Nursing AHPs and Quality. Yes, so I think that's a really interesting question that Kim poses. So Kim, the answer is we've had 3 big outbreaks very recently in community services in Ashfield, Rushcliffe and Mansfield, and they are all in kind of like what's called administrative spaces, and each of them, all 3 of them, have affected a lot of staff very, very quickly. We normally put out how many outbreaks we've got across the trust. We normally sort of like say staff are affected, and if there's any learning to be had from any of the outbreaks, we certainly make sure that they go out in John Brewin's communications each day. But in as much as how to get information further into services to say there's been an outbreak here or so many people affected, I need to give it some thought about how I can do that. With that, because there's still some sensitivities, you know, people not necessarily wanting everybody to know that there's been an outbreak as well in their area, but it's more the learning that we can take from it. The other thing that I've found as well is that there are definitely hotspots in certain areas, and we found communal areas of offices, if they don't clearly describe how many people are allowed in that space through a risk assessment, we're having a few problems. Kettles are a big problem. I found a push button access code a problem recently. I've got 10 positive staff in a very small community service. And as you can imagine, these community services are not exactly huge. So 10 members of staff in one go being positive does affect all of the services that we are able to provide. So let me give it some thought about how I get that kind of information out. We'll start to think about the learning, because that's really important to make sure that other people know that there's an issue and maybe they can learn from it as well. But with regards to getting more information out, I'll give it some thought with some of the senior managers in our community services.
That's great. Thank you, Anne-Maria. There's a question that Sandra's just put in the chat as well. Oh, Sarah, I don't know if you've just said that you wish to answer this, which is, when are the housebound patients in the community being offered the COVID vaccine?
Thanks, Sandra and Alex. So where we're at with housebound patients is today actually is the first day. So in one part of our county, some housebound patients are being vaccinated, and then there is a rolling plan to vaccinate all housebound patients before Valentine's Day. So it's a slow start today, and then it ramps up. For those people that work with housebound patients, letters were sent to everybody yesterday. So I suspect by tomorrow and the following day, your patients will be receiving letters, and that letter will set out how that vaccination is going to be done. The patients that are receiving their vaccination today for the first time, it's being done predominantly by our GP colleagues, but going forward it will also be done by some of the nursing teams as well. So Sandra, I hope that answers your question.
That's great. Thank you ever so much, Sarah. And Julie Attfield has put in the chat that we have 36 staff who are COVID positive in local mental health services. As Anne-Maria says, these are mostly related to outbreaks, but not in all cases. So thank you ever so much for that, Julie, as well. And there's one final question that's been sent in. So if anybody wants to put anything else in the chat, that would be great. Clare Town has also written, learning from the outbreak meetings is shared on the bronze calls by myself, and Donna Smith has said the same in the North Notts. And Claire's added, ask your line manager for the bronze minutes. So that's great. Thank you ever so much for that, Claire. And the last question that I've had sent in advance, if I can direct this at Anne-Maria, what is the Trust's position of buying the eye protection in a patient-facing role, working in facilities as a domestic or porter, and where do the supervisors order it from? Is there any money in the pot to buy, or a figure towards people able to get prescription safety glasses? Thank you. Okay,
thank you so much for the question, David. Anybody in a patient-facing role does not need to purchase their own eye protection, and I wouldn't want that to go out as something that we're asking staff to do at all. So anybody in a patient-facing role, and that includes facilities, domestics, porters, they're all able to access eye protection. Now, when I say eye protection, there are two different sorts in the organisation. Visors, so the spongy ones that go across the forehead, and then you've got the clear plastic down at the front. And then there's also a supply of goggles that we have within our procurement team. So all it takes is for a conversation with John Williams, as in what is required, what's needed, and they can be sent over to wherever the staff are working. So I'm really glad you've asked the question, because there is so much myths and rumours, I think, about eye protection out there. The Public Health England guidance is that anybody in a patient-facing role should wear surgical mask and visors because of the patient contact. So I think it's a really good question, because I did want to sort of like, you know, make sure that everybody hears it straight from the horse's mouth. You absolutely are entitled to something like that. So you don't. So the other bit of the question around, is there any money in the pot to get prescription safety glasses? Again, if somebody requires anything like that, it's to have a conversation with their line manager and procurement, because again, those things are available as well. So thank you so much for the question, because I know that there's lots and lots of anxiety out there about this.
No, that's great. The question was sent in by David Wern, so he's asked for me to respond back as well, so I'll do that. So thank you ever so much. Just to highlight a couple of things that are in the chat, because that's all of the questions that have been sent in. Lou Stupple, with regards to the vouchers, Julie states, thank you so much for my voucher and your honesty with the issues. Really appreciate the work that you've done on this and spent hers very quickly. And Mary Sellers states that she's hers lasted 10 minutes before landing in her inbox and being done. 3 more books on the shelf, so that's fantastic as well, so thank you. And just to add to that I've put in the chat that I know that we've had over 7,000 staff that have received their vouchers successfully, so thank you. But I haven't got any further questions. I don't know if there's anything that Anne-Maria, John, Julie or Sarah wish to update on.
I haven't got anything else. Thanks, Alex, for today.
Me neither. No.
You don't want
Julie
to talk
did.
about flu anymore, Anne-Maria?
I did put it in the thing. So I think somebody asked a really good question around whether or not that 79% is all staff. Actually, that's 79% of all front-facing staff. When we say front-facing staff, that's not really. That's a bit of a kind of like. I don't think that's a very nice saying. So it's anybody who's patient-facing. 79% is that. But we have also done 451 people who are not patient-facing, so are specifically just in administrative posts where they wouldn't ever see patients.
That's great. Thank you very so much. And Julie, I know your hand flashed up. Was there anything that you wanted to say?
There's a technical error. I will say, just whilst I got a few people on the call, we are in the throes of submitting some national bids for transformation funding for crisis and community mental health services. It's an important development for us, and it means an investment of in the region of £5 million over the next 3 years into those specific services. So I did want to just have a minute to mention it, and you know, for people beavering away in really difficult circumstances, seeing patients at the moment, just to let you know that sort of work is still going on despite the current circumstances, and thank you to colleagues who've been kind of still juggling that sort of transformation work on top of everything else. So I just thought that was worth a mention.
Thank you ever so much. That's great. And I don't know if it's just my computer, but I don't think we've got anything in the chat. I am having a couple of issues with the system, but and thank you ever so much, everybody. As I say, we had 80 colleagues joining the conversation today, and the recording will be available on Connect and we'll put it on the Facebook group. And we'll also put it in the chat here, and then it'll be on exactly the same time next week, 12 o'clock on a Wednesday, just straight from ELT colleagues being in their weekly meeting. So thank you ever so much.
Thanks very much, Alex. Thanks, everybody.
Take care. Thanks. Bye.
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 Thanks, bye.